Namaste. My name is Dr. Siddharth Taneja. I'm a senior pulmonologist at Maharaja Agrasen Hospital. Today we are going to talk about the disease called COPD. COPD full form is chronic obstructive pulmonary disease, which is caused in smokers as well as non-smokers. Smokers, basically the person is smoking around 4 to 5 or 10 cigarettes per day over a long period of time, around 5, 6, 10 years, and then he develops a COPD. The non-smoker COPD happens because a patient is exposed to harmful gases inside the home also and in industrial area also. So what happens is all the dhoop agarbattis or non-ventilated homes where chula and all are used, or poor ventilation is there, or coal burning is there inside the house, in which the smoke cannot get away from the home, and carbon monoxide or the carbon dioxide levels gets more in the environment, and other harmful gases accumulate in the environment in the home only, and then he develops a non-smoker COPD. So it happens, COPD can occur in both smoker as well as non-smoker. The symptoms of COPD can present as gradual shortness of breath. पेशेंट का हल्के हल्के चलने में सांस फूलने लगेगा, उसको कहते हैं पहले डे टू डे एक्टिविटी तो आराम से कर लेता है पेशेंट, पर ब्रिस्क वॉकिंग पे तेज भागने पे पहले उसका सांस फूलने लगता है, एंड देन अगेन स्लोली द ब्रेथलेसनेस कीप्स ऑन प्रोग्रेसिंग, और फिर उसका कहते हैं डे टू डे रूटीन काम करने में भी सांस फूलने लगता है, और स्टेज 4 तक वो पहुंच जाता है जिसमें पेशेंट को बैठे बैठे भी सांस फूलने लगता है. दैट इज व्हाई COPD पेशेंट्स रिस्ट्रिक्ट देयर डे टू डे रूटीन एक्टिविटी. They become very breathlessness while doing their day-to-day activity, and then they limit themselves to bed, and they develop other chest infections and cough and other complications with it. It can also affect them on heart and other things. So that is why COPD is a big problem and is a global burden nowadays in all of the world. So the symptoms can be shortness of breath, cough, with sometimes associated with infections, fever and all, and can have sputum production, and thus shortness of breath leading to their morbidity. So treatment options that are available for COPD patients are that treatment will come later. First we'll diagnose those patients based on their investigations. That is, we can get a chest X-ray done, ECG done, and blood investigations done. Chest X-ray and ECG will not give us the full picture, so we tend to progress to CT scan and 2D echo. 2D echo will show pulmonary arterial hypertension, can be associated with little bit of EF reduction or not, depends upon person to person. Then in CT scan we can see whether the patient is having central lobar emphysema or perilobar emphysema. Depend upon type of picture that he is, or cystic bronchitis can be there in COPD, bronchitis features can be there, other associated features can be there, which will help us differentiate how much extent of the disease is there on the lungs, and thus label the patient in which category he will fall into. Third thing is we will also investigate further. His blood investigations, other things will have to be clinically correlated for other issues to be resolved in these patients. Many of the patients can be controlled on inhalers and on routine daily OPD medications, bronchodilators, and other things. Patients who have more symptoms of shortness of breath, who are in grade 3 and 4, may require hospitalization. In hospitalization, these patients receive nebulizer therapies and other bronchodilator therapy and mucolytic therapy, but they may require invasive and non-invasive ventilation. Majority of the patients we try to give a non-invasive ventilation, that is BiPAP, NIV and all, or CPAP. Sometimes when the patient is having obstructive sleep apnea also associated because of the overweight. Otherwise, majority of them we give a BiPAP and a NIV. So if patient is landing up to more serious conditions, like he is having grade 4 shortness of breath, in those patients he might land up into on ventilator. Patients do come out of ventilator. There is a misnomer, that the misconception that the patients might not come out of ventilator when put on ventilator. No, in COPD patient we do early intubation and early extubation, and patient might respond very well Not all, but many of the patients respond very well, and if they get a timely treatment for their symptoms. But they have to take in consideration that they have to stop smoking. In any stage of COPD, the most important role is to stop smoking. Other treatments like bronchodilators, mucolytics, and other in medication and invasive ventilation or non-invasive ventilation are secondary. First thing the patient has to understand, he has to stop smoking. That is why come to the doctor, get yourself checked up, find your COPD stage, in which stage you are, and get your treatment done accordingly. And this will help you manage your life better and help you stop your disease from progressing further. And thus, you will live a very good, healthy lifestyle. Thank you.